yeah, I talked to this guy. He's big into stem cells. I've been looking for a credible source, for the stem cells, because regenerative medicine, exosome stem cells is like, it is the cutting edge of medicine. It's going to cure diseases and that really have had, no hope ever. Um, so it's really cool. But this guy gets all of his exosomes from MD Anderson, so it's very credible. But anyways, and I was
Tell us what an exosome is.
so an exosome is just basically um, the specific type of exosome that we're talking about comes from a stem cell, and a stem cell is kind of like an embryonic cell. So when you're basically you fertilize the egg, you form like a group of embryonic cells.
Okay.
Those cells have the ability to become muscle, bone, heart, brain. And so that ability for each of those cells to become so many things, the term for that is called pluripotent. And that just means it can do all these different cells.
Universal.
Yeah, universal. Well, those cells have been found to be like really helpful in healing, so
Uh-huh.
because they can turn into any cell. So they can turn into a heart cell, a muscle cell. So if you have damaged heart, damaged bone, damaged cartilage or whatever, you can take these cells, put them in that location. This is kind of a real rough sense of the science, and then you can heal and regrow that tissue.
Mm-hmm.
So what they figured out, like how the mechanics of those stem cells work, is they have these little vesicles inside the stem cell, and they do what's called exocytosis. But the cell will push that vesicle out. It contains anti-inflammatory things, cytokines, mRNA, growth factors, all these things that you need to knock down inflammation and to heal. They'll push that out. So anyways, the scientists just figured, well, why don't we just use the exosome, instead of the stem cell? There's a lot. If you do that, it's easier to deal with the FDA. It's easier to transport, and just a lot of things that make it much easier to use the exosome.
Okay.
And the exosome is what they call the working horse of the stem cell anyway. So that's what an exosome is.
Okay.
And
Is
currently they're using it for all kinds of stuff.
our stem is the only source of stem cells from like an umbilical cord?
No. So your body has its own stem cells. They're a little bit more functional when you're young. So if you have some disease process or pathology or muscle injury or cartilage injury when you're young, I mean, you can just use your own stem cells, and they typically harvest them from bone marrow or fat. And then they basically, they kind of concentrate them up, and then they basically inject them back into you and stuff.
So that's the only way to receive stem cells is with a direct injection,
Uh, yes. I mean, yeah,
therapeutically, right?
yeah, pretty much. Because if you were to take it orally, your body would break it down and stuff like that, and it
Okay.
wouldn't get into your blood, the way you need it. So they do IV where it goes right in your blood. If you have knee cartilage issues, they'll inject it right into the joint. If you have like a tendonitis, they'll inject it right into the tendon. Where if you have hair issues, they'll actually inject it into your scalp, and they're having some success with growing hair and stuff. I talked to a guy today about his experience because I've been reading a lot about it. Oh, we do exosome for hair, and I was like, is that really true? So anyways, I talked to this guy today, and he's a legit guy, good-hearted guy, and he's telling me, yeah, I've seen it. It works, pretty good.
So I've got a buddy. His name's Steve, and he has a labrum that has been operated on his in his
Yeah.
right shoulder 5 times,
Mm-hmm.
and they've gone back in. They put in these anchors and tried to help this heal.
Yeah.
But would stem cells accelerate the healing?
So yeah, um, yeah, I can't tell you how many people I've talked to over the last year, doctors, people, deeply involved in stem cells and exosomes and other capacities. I've actually talked to just recently neurosurgeon, does a lot of back stuff, herniated disc, things like that. Also, just today, talked to an orthopedic guy. They both have had such high success with stem cells and exosomes that they kind of divorced the way they've been doing things for the last 25 years. They're like, they're not doing knee replacements. So back guys like he's fixing discs, herniated disc with growth factors and fibrin injections and a combination of exosomes and stem cells, and he's healing up discs that people have had pain with for like 10 years, and they're just brand new discs, and the response is like amazing. So he's like in the past where he would have just done surgery. He's steering away from that now. He's completely doing like exosomes, stem cells. Same thing with this orthopedic guy. He's not just jumping to knee replacement anymore. So because a lot of like a huge percentage of patients he would have done surgery on, he's not doing surgery because stem cells work great.
So
And exosomes.
I know that there are hundreds of thousands of people out there right now going, huh, you mean I might not have to have that surgery?
Yeah.
So I know you're not the CFO of surgeries and stem cells, but if there was a comparative cost, what would you do? Would you say a stem cell treatment? How long does that type of treatment go?
Yeah.
Because the surgery is one time,
Yeah.
and then
yeah. So the problem with stem cells,
is it comparable?
It's not. It works great, especially for probably, I don't know, I would say 60-70% of people that are going in for surgery could probably avoid surgery. So a combination of peptide therapy and stem cells, and you can regrow cartilage. So the data's there. So just because the old thought process was if your cartilage is gone, it's not coming back. So you might as well, now or later, make your choice, basically get a knee surgery, either a partial or a full knee replacement. But now, like, there's really good data that shows that you can regrow cartilage. And if you combine it with peptides, anti-inflammatory diet, some other kind of modalities, I mean, you're really going to get a good result and stuff. Now there's, like I said, it doesn't work 100% on everybody, but the percentage is high enough to where it's really worth trying. Okay. So what keeps a lot of people from doing that? Number one, they're not informed. They don't know it's an option. They never are told by the orthopedic surgeon that it's an option. And then number two, it's because it's relatively new, it really hasn't been approved by insurance. So now you're talking about, something that could cost anywhere from $3,000 to $5,000,
for injection,
for one injection. Yeah.
Okay.
That's a lot of money, for a lot of people. And they're just like, just give me the knee. My insurance pays for that. Just give me the surgery and stuff. But man, I can tell you that knee surgery stuff, it's a beast. There's a long recovery time.
You mean replacement or?
Yeah, knee replacement. Yeah.
Okay.
Yeah, there's a pretty long recovery time. They do have, if your knee surgery and everything goes as planned, you do get a good result. You're never, they kind of tell you're really not going to go back to running marathons. Even like, some doctors even kind of recommend not like sprinting, but you can bike, like a crazy man, and you can do a lot of stuff. And for people that have like really bad pain, I mean, kind of like daily pain, whether they're walking or not, I mean, a couple of days after surgery, it's gone. So there's a lot of good stuff about the surgery.
So,
but for me, I would rather keep my own stuff, be able to play basketball, do stuff like that,
right.
But
so I just turned 60. I had my knee completely rebuilt.
Yeah.
Medial collateral, ACL was blown, the anterior, everything was blown.
Yeah.
And I have no cartilage in my left knee, but I haven't had any problems, okay, yet, knock on wood, right? So is there something that I could do that's preventative? So is stem cells preventative as well?
Oh, yeah, without a doubt. So being proactive, with your knees is the way that you'll never get in a situation where it'll be like, hey, you're going to need surgery. So And you can do, there's some really cool stuff in the peptide world. There's BPC, 157, and there's TB 500, and they're peptides. Um,
FDA approved?
they are not FDA approved, but there's still a lot of research and evidence out there
Uh-huh.
that I think, you know, with a physician's recommendation, I think you're on a pretty safe ground and stuff, even though the FDA is not approved. But the FDA really likes to have like 30, 40 years, even longer sometimes research just to make sure nothing crazy pops up. In the meantime, you have people like, older, men,
Aging.
women, that their quality of life is just shot. They're like, they can't do anything anymore, and they're in pain. And like I said, surgery can be a beast, especially if it goes the wrong way. Then you have to have a second surgery, and then you're 6 months out for the first one. Now you have to have a second, you're another 6 months out. I mean, it can be rough. But yeah, so anyways, to answer your question, yeah, you can be proactive with peptides. That'll decrease the inflammation. It'll also help cartilage growth, and they have some other peptides too that are shown to kind of increase your cartilage.
Mhm.
Anti-inflammatory diet, um, things like boswellia, glucosamine chondroitin, and other kind of inflammatory things you can take, supplements outside of the peptide world, and then you can do stem cells too. But you put all those together, I mean, yeah, you
So,
should you should be pretty good.
can you describe like essential elements to like an anti-inflammatory diet? Like if somebody's out there and they're saying, okay, what do
Yeah,
I need to get rid of? What do I need to add?
yeah. So an anti-inflammatory diet, it's relatively tough on people because if a true anti-inflammatory diet, you're not really going to eat beef, you're not going to do dairy, and you're not going to eat chicken. So
And
I can't tell
chicken?
you how many people I've talked to, that like come in, they're eaten up with arthritis, or they have some autoimmune. I mean, they're in a bad situation, and I'm like, well, you need to do everything you possibly can from an anti-inflammatory standpoint, and one of those things is change your diet. And they're like, well, what does that entail? And I'm like,
Mhm.
quit beef. And they're like, oh man, I'd rather die than do that.
Yeah. Well,
But
red meat I can see, but you said chicken too?
yeah, I mean, unfortunately, most, chicken, beef, and dairy, it has so many things shot up into it. I talked to several guys that raise beef, and they're just like, we can't make any money. We get paid by the pound.
Hmm.
We literally cannot make any money growing stuff organic. We just can't do it. So, anyways, because of that, there's all kinds of stuff in beef and in chicken and things like that are kind of inflammatory. Um,
100%.
yeah, but
Absolutely.
I mean, I've been doing like a pescatarian diet. It works really good for inflammation. So you can still eat fish, things like that, and you could still get away with eating like, depending on how bad your inflammation is, and it varies with everybody. I mean, maybe you could eat a steak a week and get away with it, but if you're just jamming on beef and chicken and dairy every single day, and when you're younger, don't get me wrong, when you're younger, you have all these repair systems that are really good for knocking down inflammation. But as you get older, those systems start going away, and what used to not be a problem at all is a problem now.
So would
So
maybe a good rule of thumb be cook everything you eat?
yeah, you definitely. I think that's always a good rule of thumb.
Because
Yeah,
that's where I'm at.
yeah,
I'm training for a triathlon
yeah,
and I eat chicken, kale, sweet potatoes,
yeah,
water, and some coffee.
yeah.
Seriously, that's it.
Yeah, I'll tell you an interesting story, and I think this is a really good way of making people understand. First of all, our diets are completely messed up. The
Uh-huh.
all the crops and everything like that. It's from basically grown out of soil that doesn't have any nutritional value anymore. And then a lot of our meat, we've been trained to like just eat the muscle. But if you look at almost every apex predator on the planet, the first thing they eat is like the liver, and then they eat the heart, they eat the organs, because that's where all like the key nutrients are. The last thing they eat is the muscle, and that's what we do all the time. We always
Interesting.
eat the muscle. But anyways, the point of that whole story is like most everybody that's doing a typical American diet and stuff, not supplementing or whatever, or not getting organic, food, is probably in some way nutritionally deficient and stuff.
So organic's worth it.
Yeah, it's worth it, but even organic comes with issues,
Yeah.
because of the way, because of the pesticides and stuff. And there's certain rules and regulations about, if you're going to label your food organic and stuff, but there's loopholes to where even organic
This is
food
true.
can have issues. So it's horrible because, I mean, you almost have to have like a PhD in nutrition to like navigate like what food to eat, what food to not eat, or, have a good source where somebody's kind of guiding you.
Hmm.
But people are so busy these days. I mean, they come home, they're fatigued, they're tired, they're stressed. I mean, last thing they want to do is like not eat the way they want.
So I remember going up to the lodge
Yeah,
a few months ago, and we even got some nice video out there.
yeah.
What's going on? What's new at the lodge?
So the lodge is, it's just constantly my passion. I I mean, there's not a day that doesn't go by that I don't think about or try to put another piece of the puzzle on the table in terms of implementing kind of the med spa retreat.
Yeah,
Um,
for those new to the podcast, can you kind of educate them on what Wolf Lodge is and like the
yeah,
philosophy and
so
stuff?
Wolf Lodge is basically going to be a med spa retreat, where we do regenerative medicine, peptide therapy, some of these kind of cutting edge medicines and supplements and dietary things that really can help people have a really good quality of life. And I've always thought it's really important also, to have a proper setting to do all that in a place where people can meet, they can commune, they can talk about their experiences. And today I talked to a couple of guys that I think are going to really be able to help
Hmm?
where we're going with the med spa. But we're going to start doing ketamine treatment for mood disorders, treatment resistant depression, anxiety disorders. And we're trying to actually evolve and navigate some of the regulation pathways to let us do psychedelics also as a treatment modality. So, um, Wolf Lodge is very much going to be a holistic place where you can come for holistic medical treatment. Um, and that includes every aspect of treatment. But there is going to be a big focus on ketamine and things that we can, and psychedelics and stuff that we can do to treat mood disorders and things like that.
All right, so I've heard of Ibogaine, and I know Rick Perry's really pushing for that, the Ibogaine
Yeah.
initiative in Texas. What's ketamine?
So ketamine is a non-dissociative hypnotic drug. So it's a little bit different. Each kind of, it's a little bit different than your typical psychedelic like psilocybin or LSD or whatever. It works in a little bit different uh, pathway, and it's a very interesting drug. So the history of ketamine is anesthesiologists used to use it as
Yeah.
kind of an induction. So they used, when people were getting put under, getting ready to take their appendix out or whatever, they would use ketamine as part of that cocktail, to
Uh-huh.
knock them out and stuff. But anyways, after doing this for years and years, all these people started coming up and telling their doc, well, it's weird. After the surgery, I don't feel like I need my depression medication anymore. Anyway, somebody finally figured it out. It's like it's the ketamine, that they've been using during surgery. So then they started really pouring a lot of energy into like trying to figure out why that worked. So ketamine is really very interesting, and now they've done like hardcore research on it. And ketamine is one of the most efficacious, well, I would say it is the number one medicine right now for treating treatment resistant depression. And the results are like 60+% of people that do ketamine have a very positive response, even after having a history of what they call TRD, treatment resistant depression. And that's a big deal because what that means is treatment resistant depression. They've been on multiple meds. They've been on multiple meds, for year after year after year. And now all of a sudden they can get a couple treatments with ketamine, and they're hugely better. And even a significant percentage of those patients are actually coming off their meds after being on meds for like 10 years.
So can you describe what a ketamine session looks like?
Yeah. So we actually do them at Advanced ER. We did a lot of research before we stepped into that arena. So we made sure that, all the claims that they were making about ketamine were legit. But anyways, so ketamine session, you come in, they talk to you, they make sure you don't have any contraindications to ketamine. Like if your blood pressure is too high, et cetera, little checklist. Most people don't. Then they go into a room. It's a quiet room. They usually come in with some headsets, noise reduction, and we put an IV in them, and we dose them with IV ketamine at 0.5 mgs per kg. We put them on, kind of monitors, just to make sure their heart rate and their breathing and everything is okay. And that's really not even necessary. Ketamine is such a safe drug that you really don't have to worry about any kind of major heart palpitations or problems with respiration or anything. But it's just kind of more of a formality. So they come in, they get it. Takes an hour to give an IV. We give them another 30, 40 minutes to recover after that. So it's usually about 2 hours and you're done.
So it is a non-addictive antidepressant.
It's a non-dissociative anti-hypnotic drug. That's the classification for it.
Okay.
And how it works is it blocks a glutamate receptor, and basically that causes increased glutamate, which kind of allows your brain to start producing more neurons. So the end of a neuron, the end of your brain cell, there's a synapses there. And it'll start producing more of those. And it also increases, for a short period of time, neuroplasticity. And that allows your brain to kind of remodel and rewire in ways that are kind of unique to taking ketamine. So anyways, it does some real structural change to your brain. And that is directly linked to like the reason that you get better and stuff.
Could ketamine then replace an SSRI?
Oh yeah, without a doubt, for sure. Yeah, I mean, so an SSRI, a serotonin reuptake inhibitor. Problem with that is, by definition, depression is a lack of serotonin. Well, all a SSI does, serotonin or serotonin reuptake inhibitor does, is it just allows the receptor that takes that serotonin up and kind of recycles it, just blocks it. So all you're doing is taking the serotonin that you have and kind of rationing it. You're not making more serotonin, so you're really not fixing anything. I mean, in terms of an actual fix. So, and on top of that, they have a huge amount of side effects and things that I mean, it can even
so many students that I can verify that.
Yeah, no, it's just crazy stuff. And I think, I think they had their place in their time. But I think with the psychedelics and with a lot of this other stuff, they're figuring out ways to where you're not going to have to be on long-term, meds and stuff. Now, not everybody, unfortunately, there's still a small percentage of patients that don't respond to ketamine or the psychedelics or whatever. So, I mean, serotonin reuptake inhibitors might be around for a while.
So
but
you were saying, though, that ketamine enhances neuroplasticity?
Yes, it does. Yeah.
So wouldn't that be good maybe for somebody that has Alzheimer's or has onset of dementia?
Well,
Don't they want to increase neuroplasticity?
Yeah. There's a possibility for that. I know that with psychedelics, like I just read a study that was done on animals, and this study was done with DMT, which is a psychedelic. Um, but they took mice that had had an ischemic stroke, and they expected, like a certain percentage of those neurons that had ischemia to die and stuff. Anyways, they gave them DMT, right after the stroke, and like where they expected, I'm just going to throw out a number, like 60% of those ischemic cells to die after giving them DMT. It's like 20% of them died. So DMT really did help in terms of like not only like protecting the cells that were damaged and bringing them back, but it also has neurogenic properties, which will kind of help it regenerate neurons. Now, I really haven't read. I do ketamine. I do believe does have a neuro kind of genic property with it. I think a lot of the effect comes from like just having the neuron that's actually there helping it grow, and helping it grow more synapses. That's where one neuron connects to another neuron and stuff. But I do think there is a little bit of neurogenesis with ketamine. I have not seen any articles specifically talking about ketamine and Alzheimer's or neurodegenerative diseases and stuff.
Okay.
I do know that, like I said, that's kind of why I jumped to the psychedelics, because there is a lot of literature about neurogenesis with psychedelics and stuff.
Okay, so we're talking about ketamine, and we're talking about maybe the different populations that ketamine could help.
Yeah.
So we've talked about somebody that's suffering from depression, quite possibly somebody that has, the onset of dementia, possibly, right?
Yeah.
But what about all the soldiers that have come
Yeah.
home and have are suffering from, and there's an epidemic of suicide in our country.
Yeah. So ketamine is amazing. So one of the reasons ketamine is so amazing, because it's probably right now the number one drug for suicidal ideation. And that's for two reasons. Number one, it works amazingly. So the efficacy of it, just completely getting rid of like suicidal thoughts, is very good. And in addition to that, it can occur rapidly. So, I mean, if you within your first treatment, your suicidal ideation thoughts are going to decrease dramatically, and then your second and third and fourth treatments, there's a really good chance it's just going to go away. And couldn't happen at a better time, because right now suicidal ideation and suicide rates are probably the highest they've ever been, in our country and stuff. So there was really a huge need for something like ketamine. So so that so
It's been
ketamine's
around forever, though, right? I mean, for decades, hasn't it?
What's that?
Ketamine.
Yeah, no, it's been around. Like I said, they used it for analgesia. They used it for procedural sedation. They used it for anesthesiology. And it's just, the more research they, did with ketamine, the more they kept finding out that it could do like a bunch of different things.
So it didn't become emergent as um, like a treatment for depression maybe in the last 10 years?
Yeah, last 10 years. Yeah, I'd
Okay.
say that's pretty fair. Um, Yeah, so pretty amazing stuff. So ketamine is really good for suicidal ideation. PTSD, it's actually been shown to work pretty good on PTSD. Right now, it looks like one of the drugs that works really well on PTSD is MDMA, which is basically ecstasy and stuff. So so those two things are kind of leading the front right now in terms of PTSD treatment. And there's other treatments for PTSD that don't, kind of involve drug therapy, but yeah, in terms of drugs, those are the two big ones, I think.
Um, there's people that describe ketamine experiences as deeply spiritual. Have you had any
Yeah,
exposure to that?
I'll tell you about one. We had one lady, so they go into what's called a dissociative state, and it can be it's a very vivid, kind of dream state. And we had one lady, and when she came out of it, because I always ask, how was it and how are you feeling and things like that. And the one lady said, I was sitting on a bench for hours talking to a giant Jesus. Like, well, that's cool. And then, you're like, why giant? I don't know. Who knows. But anyways, giant Jesus. He was talking to a giant Jesus. And then we have another story was this lady had, her dead grandmother, held her hand and consoled her and talked to her for
Wow.
hours, about like the stress she was going through. But um, yeah, you get some really amazing stories, when they're in that disassociative state.
So, are there places like a ketamine clinic, or I know advanced ER,
Yeah,
right, can
yeah.
administer?
So yeah, we do, like if you're in a crisis mode, like if it's on the weekend, or you're just having some kind of mood disorder or crisis, we're kind of the ideal place to go. Um, we're an emergency room, so we're allowed to do kind of emergent
Mm-hmm.
treatment. Like I said, if you're having a crisis or there's nowhere else to go, um, and we do IV therapy. And the good thing about IV therapy is the dosing. There's no you know for sure you got the right dose when you do IV. A lot of the clinics will do, intranasal, maybe IM, things like that. So you don't always initially you might not initially get the right dose and everything like that. But yeah, what we do is we usually do one or two therapies and then we refer to a clinic. There's a clinic we work with, North Texas Psychiatry. They're really great, and they'll finish up the rest of the treatments, which can be anywhere from kind of 5 to 6 more treatments. And all the research that's been done on ketamine and how good it works, basically has to do with like the 6 treatments and stuff. So
Okay, so let's circle back to the lodge.
yeah,
And the lodge is going to be a place where people can get together, they can receive treatment, they can talk amongst them. It's
yeah.
almost a community. Um, so, in 5 years from now at the lodge, what would be an ideal menu that they could have when they get there? They could have a ketamine treatment. They
Yeah.
could have what would in like 5 years from now when everything is
Oh
done.
man, I can't wait.
Talk to me about the vision.
Yeah. I mean, part of this is kind of my legacy, and it's kind of part of how I want to live my life. I want to be a healer. I can think of no better kind of tail end to my life than going up to the lodge, treating people, hearing their stories about how they feel better. And of course, you're going to make a lot of friends, along the way. And have this great team, of people. I just think it's going to be such a positive environment. But um,
Sounds
yeah,
peaceful. Sounds peaceful.
it'll, my daughter, she's always wanting to do all this crazy, exciting stuff. And I keep trying to tell her and it's hard to tell a 19-year-old the value of contentment and peace and spiritual rest and quietness. This is hard. You tell anybody that's been through life and experienced all the stress and the ups and downs, it's easy to convince them, but try to teach a 19-year-old that.
Mhm.
But anyways, that's kind of what I want for the ranch. I want to, have people have a better quality of life and some peace and brotherhood and sisterhood, things like that. Um, but yeah, so I have this. I've always loved Disney World. I've always loved Disneyland. I love imagination. Walt called it Imagineering. And I just love that term. But that's kind of what in 5 years I want to really have some concrete imagineering in place.
Mhm.
And my dream was, like I said, you have the lodge, where people can go and have big meals, and then they're going to have these little cottages with like, jacuzzis and like
Jacuzzis.
saunas. So you'll have one cottage, it'll be, very like old Western, like 1800s. You
Mhm.
might have another little stone cottage or whatever that looks Swedish or something. But each cottage will kind of have a little theme. And if people want to, get a treatment and get nutritional counseling and get,
Anti-inflammatory nutritional
yeah, that's
counseling.
right, that's
Yes.
right.
Okay.
And then get, some other kind of modality that's going to help with their health. We kind of want to have that all available. So, but they could certainly just come in for a quick treatment to where they, just do the ketamine and, we kind of do the 2 hour session and they're out. But if they want to stay longer,
Uh-huh.
learn about their health, kind of do other things, we'll probably provide that too also. Provide.
Can you as we wrap up here today? Can you tell me what's going on at Advance ER?
Yeah.
Just maybe even this weekend, right? Or...
Yeah. Yeah. Oh, yeah. So there's, so yeah, Advance ER, we always kind of got something. We're very involved in the community. I think one of the exciting things that we really love to do at Advance ER is the 4th of July parade. Last year, it was a blast. We have a float. We have the Rust Band that plays on the float. And man, there's so much energy. It's great. And so we get out there. We got the Rust Band. As we kind of round the corner, the crowd's like, getting into it. They're all dancing and everything like that. And people are like, Advance ER, you saved my grandpa's life, So there's, I mean, the energy is really just amazing. So, but we got that coming up, and the Rust Band is going to kind of revisit all that, and we're going to have them out there again. And other than that, I think it's just kind of status quo. We're doing really good, and we're just looking forward to the 4th of July.
Absolutely. Doctor, thank you so much.
Yeah, thank you.
And ketamine, that's a buzzword out in society right now, but I know that a lot of people have learned a lot.
Yeah.
Thanks.
Yeah, you betcha. Man, I had a foot cramp the last 15 minutes.